Thank you very much. You are all most welcome. My internet is bad. I will unmute for a short while and then remove the video. Thank you very much. You're all welcome to this capacity building meeting of applying the social norms exploratory tool. And we are very privileged to have all of you attend this meeting. But more so, we are also very excited about our facilitator today, who is going to take us through the training. Catherine Baker, who is an assistant professor at the University of California, San Diego, within the Center for Gender Equity and Health. She holds a Doctor of Science in Social Epidemiology from Harvard University. And her research centers on examining the role that gender and social norms play in shaping adolescent sexual and reproductive health outcomes, as well as the multi-level examination of risks and resilient factors for gender-based violence in the United States. She has been involved in the social norms exploratory tool development and training, and including most recently the Save the Children project focused on adolescent sexual and reproductive health in Mali, Burkina Faso, and Niger. So we are definitely very excited to have you around. And also the colleagues who are here. And I would request, this is organized under the East African Social Norms Collaborative Network with the university, the California San Diego University. My colleagues, I think I'm going to give you a minute to introduce yourselves, and then we proceed. I would also request that the members please do introduce yourselves in the chat room. You put your name, your email contact, and also your organization, so that we don't spend a lot of time introducing ourselves. Can I request Meredith, Madanda, and the team that is going to lead this this session this afternoon?
Yes, please, Madanda, would you like to go first?
Yes, thank you very much. Maybe I follow Grace's example to show my face a little bit. My name is Ramanzani Madanda. I work for K International in Uganda, and I'm one of the people participating in this Africa Learning Collaborative. Nice to meet you here, and looking forward to this very wonderful interaction. Thank you very much.
And then maybe just in the interest of time, the UCSD team can drop a brief hello into the chat box and a description of their role here, who supports the program.
Okay, so thank you very much, all of you. I would now really introduce Catherine and request Catherine to come on board. We're so excited because last time we had a great job and you left many of us really wanting more and more and more. So you're most welcome.
Thank you so much, Professor Grace and Madanda, and for all of you for being here today. Last session, I know we had a very rich discussion, and we're hoping to be able to do that again today. Could I just see in the, would any of you who participated last time, please just show with in Zoom, just a thumbs up in Zoom, so that I could see who all joined us last time, if anyone did. So if you participated last time, please give a thumbs up. Okay, so a few of you participated last time. Okay, great. So This session will be a short recap of a little bit of what we covered last time, but mainly with this session, and we can actually show the slides, please, Marilyn. You'll have to also excuse my voice. I have a bit of a cold, so you'll see me drinking my echinacea tea to try to stop coughing. So what I'm hoping to bring everyone through today is to provide just a quick review of the key social norms concepts that we went over in our last session, and to review the phases of the social norms exploration tool. And I believe you all will either receive a link to the PDF of the social norms exploration tool probably later on in the training. Maybe Meredith or Marilyn, you can drop that into the chat box for everyone so they have access to the PDF. But the main focus of our time together today will be to work in small groups so that you all can apply the social norms concepts to your own work and examine a social norm and the causes of some of the problems and behaviors that you all are addressing in your own work in real time with their small groups. And we'll have a chance, we have two amazing panelists with us today that I'm so glad that you're both able to join, John Bosco and Ramanandan. Would you both like to introduce yourselves at this point? Maybe we could start with John Bosco, please.
Hello, my name is John Bosco Basomingera, and I work with FHI 360 Tanzania with the USAID Tulonge Afya project, and I work as a senior technical advisor for social behavior change, focusing on maternal, newborn, adolescent, and child health. Yeah, I think that's enough.
Okay, thank you. Ramanandan, I'll pass it over to you.
Hello, everyone. I hope I'm audible.
Yes, we can hear you. Thank you.
I am Ramadan Bob Chirunda. I work with the Impact and Innovations Development Center, and I'm the technical advisor for monitoring, evaluation, learning, but also quality improvement. So my areas, of course, of expertise and use of the social norms exploration tool are SRH, gender-based violence and violence against children, but also in NCDs, yeah, type 2 diabetes. So we've done work around that area, and we support East African partners who are doing work around violence to integrate social norms programming in their work. Good to be here. Thank you.
Excellent. Thank you so much. And thank you both so much for being here today. So both John Bosco and Ramanandan have worked extensively with the social norms exploration tool, and you heard from them in the last session. So we're so glad they can be here again today to share their wisdom and expertise using the social norms exploration tool. And then we'll quickly wrap up with how to identify the reference groups of the populations that you're working with, and end with time for question and answer. So we'll move on to the next slide. Just again, thank you, Marilyn. The training objectives are to 1, increase your knowledge of key social norms concepts, 2, to increase your knowledge on how to implement with your programs the social norms exploration tool, and also to really give you all a chance for some hands-on engagement with the SNET. So we'll move on to the next slide. So first, what are social norms? Social norms are the implicit informal rules that most people accept and abide by, and how they guide social interactions. Social norms are really influenced by the belief systems and the perceptions of what others expect us to do and what they themselves do. And they are social norms are enforced through rewards and sanctions. And don't worry, we'll get through all of these terms as we move along here. But one point here is that social norms are embedded in both formal, so for example, policies and governmental systems, as well as informal institutions, so our community groups and our neighborhood groups. They're also produced and reproduced through this social interaction. Okay, thanks, Marilyn. The next slide. So you'll see here that there, again, the definition of social norms here is provided at the top. And also you'll hear in social norms terminology that there are two main types of social norms. These are descriptive norms, or what you think others do, and injunctive norms, so what you think others will approve or disapprove of you doing. So for example, a descriptive norm is, I may think that most mothers in my community breastfeed their children. And the injunctive norm would be, I think that people would approve of me breastfeeding my children. I'm also including a definition here on gender norms, because gender norms are so central to a lot of the work that we do in the field of global health and reproductive health, as well as violence prevention. So gender norms are what we call a meta norm, or a larger norm that would encompass many other norms. So one behavior that we'll be exploring later today is that of gender-based violence. That behavior is really rooted in many norms that inform this larger meta norm of gender norms, or how expectations of individuals should behave based on their gender identity. Right, so we have norms showing that men should behave in a certain way and women should behave in another way, and individuals who don't quite conform to that may be treated differently. So on the next slide, just a careful distinction here between behaviors, attitudes, and beliefs, and some of the other terms that I mentioned earlier. So the behavior is, of course, what I do or what others do. An attitude is informed by social norms, but it is separate from social norms. So an attitude is what I prefer. So I prefer to breastfeed my children. Oh, I see a question in the chat. Could social norms shape gender norms? Yes, they are. Gender norms are a type of social norm. They're a specific type of social norm. Thanks for that question. And yes, I suppose there are other social norms that would inform that. They're all mutually reinforcing, but we really see gender norms as a special type of broader social norms. Thanks for that question. A belief is also informed by norms, but it is what I know, what I believe I know. So I believe that breastfeeding my children is good for my children. And that's a belief that I hold, but it's different from a norm. And we'll be able to talk about these more in our small groups, so I won't dwell on these here now, but just to put out this scaffolding here. A reference group, which we'll be talking about later, are the people whose opinions matter to me and the people who will enforce the social norms around me. So for example, with the breastfeeding example, my mother may be an important reference group, or mothers may be a really important reference group to that behavior. And the sanctions are the rewards or punishments that a community or other individuals will follow for, believe will happen if you engage in that behavior. So one reward might be that I would receive approving smiles from people in my community if they saw me breastfeeding my child, or a sanction if I was in a community that was not supportive of breastfeeding would be disapproving stares or glares from people walking by if they saw me breastfeeding my children. So let's do a quick group poll just to have you start thinking about social norms. And I'd like you to just respond in the Zoom chat box to this question: how did social norms influence my behavior this week? So think about the social norms in your context and how those norms may have influenced your behavior this week. And you can just put those in the chat to share with everyone. We'll just take 1 minute for this activity. Okay, great. I can see people responding. Warren, thanks for that excellent example. Mask wearing for COVID, that's a great example, right? So we see all over the world that that social norm of wearing a mask is very much, that behavior is very much influenced by social norms. So for example, where I live here in California, it's largely the norm that people wear masks. But earlier this week, I saw someone out protesting, saying to remove masks from our children in schools. So people were fighting against the social norm. One person has said, yeah, so feeling compelled to attend a wedding that you normally wouldn't want to. So this was perhaps influenced by a sanction that this person may have felt if they didn't participate. So for example, the family would have shunned this person for not attending the wedding. And cautious of movements due to what's going on in the country in Ethiopia. So there may be a norm that during the unrest, people stay put. One does not venture out of their house if there is unrest going on. Yeah, great. These are all excellent examples of norms. Thanks so much, everyone. Unfortunately, we don't have time to go out or to read all of them, but yeah, those are all fantastic norms if you all want to skim through the chat. Okay, so Marilyn, we'll move on to the next slide. So the social norms exploration tool is what's known as a norms assessment. And these norms assessment are the series of activities that you all will learn about through the social norms exploration tool that help us to determine really quickly, so in a matter of weeks, how to determine the most relevant social norms that are affecting the behavior of interest in the groups that you may be working with. So these assessments can help your projects throughout the project life cycle. So ideally, you will implement the social norms exploration tool during the program design. So while you are still designing the intervention and identifying who to work with, but you can also use a social norms exploration tool to determine implementation strategies even after the program has started, if you need to retailor or restructure the implementation. You can also use the social norms exploration tool during monitoring and evaluation. So for example, if there are certain indicators that are more normative, you may wish to include those after you've conducted the social norms exploration tool to see whether or not your program has impacted those at all. On the next slide, this is a key summary of what the norms assessments will help you answer. So there are these 4 questions here on the left side, and on the right side, you'll see why this is important. So for example, this first question, you would be able to answer who the important reference groups are that are influencing the behavior in your program. And by identifying these reference groups that do or do not support a certain behavior, this will help you to identify the right people to include in your interventions and behaviors. So for example, if your project is working with adolescent sexual and reproductive health, and you find that, okay, we've looked at all of the structural barriers, we've made contraceptives available to the adolescents, they're in the clinics, but through the social norms exploration tool, you find that the adolescents are afraid of going to the clinic. Well, why is that? Why would they be afraid of going to the clinic? Well, you learn through this exploration process that, in fact, the providers are unfriendly to married adolescent girls who try to go to the clinic for contraception. So the reference group here would be the clinicians or the people working in the clinics who are supposed to be providing contraception to the adolescents. So you would need to include those individuals, the clinicians, in the intervention as well, if you are to see any increase in adolescent contraceptive use. And so I won't read all of these. I believe you'll have the slides available to you, but in the interest of time, I really want to get us to the small group work. You all can come back to this if you need to. But essentially, we're going to be asking, what are the reference groups? What are the social norms? Why do people comply with the social norms? And what is the most influential social norm? Okay, so on the next slide, thanks, Marilyn. This increased focus on social norms, just a little plug for why we do this, can really help development impact by creating this environment in the community, not only in the local community where the program is implemented, but also in the field or the community of practitioners and people who are implementing the project that will help sustain and spread this behavior change over time. And addressing norms can drive multiple behaviors. So we were talking about this meta norm of gender norms. If we are to start focusing on changing gender norms, we may see changes in not only contraceptive use, but also gender-based violence, girls' education. A number of different behaviors can be impacted when we address norms. And it's also providing a common avenue of collaboration. So if all projects begin to agree that gender norms are important to address, there may be this common avenue for change. So rather than working in silos that so often plagues our field, there's this common avenue for change. Okay, so quickly, let's review the phases of the social norms exploration tool. So briefly, the social norms exploration tool is really this guide. It's a PDF of a number of different activities that allow for the rapid identification. Thanks, Camille, for dropping. Camille just put the link to the social norms exploration tool in the chat box. So feel free to download that and save it to your computer and refer to it later on. You won't need to access it during this presentation. So please just save it to your computer and you can refer to it later. The social norms exploration tool allows for this rapid identification of the reference groups as well as the most important social norms influencing behavior. So on the next slide, we see that there are 5 phases to the social norms exploration process. Today, we're going to be focused on the first one, which is really planning and preparing with the internal project group of how to implement the social norms exploration tool. The second phase is to identify reference groups. This is done through rapid interviews and a really quick analysis of data that are collected. We call them speed interviews with your key populations. And when I say key population, I mean, for example, adolescents, if your project works with young adolescents. The third one is exploring social norms. That's done with group discussions with the both the reference groups and your key population of interest. So they can either be focus group discussions or individual discussions, depending on the activity that you choose. And I'll get into the activities next. Then we analyze the findings in phase 4, and then phase 5, we apply the findings. So again, thinking back to the project life cycle, depending on where you are in the project life cycle, you could either apply those findings in how you design your program, how you're implementing your program, or how you may be monitoring and evaluating your program. On the next slide, we see here that these are the main exercises. Oh, sorry, Marilyn, next slide. Thank you. Phase 1 is really to plan and prepare. So we will be focusing on this first set of exercises, which is to use the social norms lens to develop a new understanding of your project. And we'll be doing a problem tree analysis. The next step in phase 1 is to decide on population segmentation. So for example, if you've been working, I keep going back to an adolescent population, apologies, that's my field of interest. So I'll just stick with that. You'll have to excuse me, but we can apply this to other populations too. But let's say adolescents. So we might want to segment between boys and girls, or we may want to segment also by younger adolescents, ages 10 to 14, or older adolescents, 15 to 19, or we may be working with a group of adolescents, some of which are in school and some of which are out of school. So you can choose how to segment that based on important differences between the groups that you see. Then you need to define the aim and objectives of your social norms exploration, and choose which exercise to use, which we'll be talking about. Determine which communities you want to work with, and finally prepare for the logistics for field work. Okay, and phase 2, which we'll be talking about very briefly here, is how to identify the reference groups. And we'll be doing at the end after the problem tree, so we'll come back to that. So again, phase 1, the focus of our problem tree exercise today will really be to for you all to work in small groups and do a problem tree analysis on your own. So let's get into phase 1, activity 1, this problem tree analysis. So the goals of the problem tree analysis is to work with your implementing team. So this is before you even go out into your population of interest, but to just work within your team to develop an understanding of your program and to internalize and apply social norms concepts, and then relate those concepts to your program. Okay, so let's go on to the next slide, which is the problem tree. Here's an example of the problem tree. So this is in French, but it just shows you an example of what a problem tree is. So on the trunk of the tree, we see that they're trying to address low use of family planning. And then at the bottom, we see the root causes that the team brainstormed. And so what we'll be doing today through the problem tree is identifying these root causes of the problem. And these can be both social and non-social. So for example, social would be our social norms, saying that it's inappropriate for married women to be using family planning. But there may also be non-social causes. So for example, there may not be access to contraceptives in some of the populations that you're working with. So we will be identifying both these social and non-social. Okay, so then on the next slide, this is where I was talking about there are 3 different exercises in the social norms exploration tool, or that the social norms exploration tool provides. And so depending on what you're trying to do, you can choose one of these. The problem tree gets at all of them. And so we use the problem tree at the onset, but when you work with your populations, you can choose one of these 3. So the first one is asking the 5 whys. And so why does this exist? This one is really easy to adapt. It's very easy to analyze, and the skills for facilitation would just be pretty basic. The second one, as I was just mentioning, was a problem tree analysis that allows you to identify both social and non-social causes of behavior. And the last one are the vignettes, or short stories. So in order to use a vignette, the team would need to develop their own short story. Okay, so on the next slide, we see just an example of the 5 whys. So here's the behavior that we're interested in. Why don't married adolescent girls seek reproductive services? So the team might have come up with, oh, girls are afraid to visit a clinic, girls can't afford services. So then we keep asking why? Why are the girls afraid of visiting the clinic? And then we come up with a whole set of other reasons. And then we keep asking why until we get to some of these root causes. Okay, and the next one, just a quick example of what a vignette is. Excuse me. So here you see, here's a short story talking, the problem here is girls' education not being prioritized. So this is just a short story that the project team came up with to help the respondents think through some of these issues and then some questions. So you'll find this in the SNET on pages 42 and 69. So you can come back to that. Okay, so let's move into our problem tree exercise now. So we will, Camille, are we still doing 6 groups or are we doing fewer groups?
I think we should keep to 3 groups just based on the size that we have
Okay.
today.
3 groups, sounds good.
Yeah.
So we'll have 3 groups and each group will have a different problem or behavior. So we'll be looking at women's unpaid care provision, gender-based violence, and adolescent sexual and reproductive health. And so when you break into your small groups, we'll be asking that your small group identify 2 different leaders. The first one is to fill in the tree based on the team's ideas. So you'll basically just be taking what the team shares with you and putting it into the tree. We'll be doing this online, so you'll need to have access to your computer. And another leader will be just jotting down the main ideas, and they will be sharing back the key findings in our large group after we all come back. So these directions will be in your online platform with your tree, but I'll just review them here. So like we saw on the previous slide, under the tree where all the roots are, please list all the factors that may influence your behavior. So these can be individual reasons. So for example, like an individual psychology or biology, our social norms, the community resources that people have access to, economic issues, and then these macro events, which include civil conflict and political. And I like to blend the problem tree and the 5 whys. So for example, if someone says, well, it's taboo for adolescents to be using that. Well, why is it taboo, right? So you can use the 5 whys to sort of drill down to that. And on the next slide, after you're done with listing off the behaviors, so you might want to, or the root causes, you might only want to take about 10 minutes for that. Then circle or highlight in a different color the root causes that are related to social norms. And then just focus on those that you highlighted that are just centered on social norms related factors, and discuss the types of norms that may be at play. So really discuss whether this is a descriptive norm that's done because other people do it, or if it's an injunctive norm, that the behavior is done because other people expect you to do it. And then in maybe the final 5 minutes of your group work, you can complete the sanctions and rewards box. So what are the benefits to following the norm? What are the rewards? Or what might be some consequences of not following the norm? So with that, let's break out into our small groups. I think you'll be randomly assigned, but I'll let Camille walk us through this next process. I hope everyone found that to be a useful exercise in speaking with your small group. So what I'd like everyone to do now is we only had the 3 groups. So let's by group, just provide the norms that you identified as the main social norms in your group. So why don't we start with the behavior of gender-based violence and hear from that group about the norms that they identified and any other interesting insights that their group had during their discussion. So I'll turn it over to the gender-based violence group, please. John Bosco, we can't hear you. We can see you, but we can't hear you.
Sorry, the common problem. I hadn't unmuted my mic. Can you hear me now?
Yes,
Can
we can
everyone
hear you
hear
loud and
me?
clear. Thank you.
Yeah, our colleague will project, the one who was documenting will project the tree, and she can take us through the root causes we have analyzed, and those that relate to social norms were, yes, were color coded. So welcome, Meredith. Meredith, would you like to take us through this? I can also read this one.
Yeah, why don't you take us through?
Yeah, sure. So well, group number 2, which was working on the GBV as the selected behavior, we found out a number of root causes for GBV. The first one being power imbalance and relation between men and women, which is a common belief in a number of communities, and we found this as related to social norms. And the second one was economic issues, which doesn't relate to social norm, different access to control over resources. This one also, we debated a bit about it and we left it. Lack of awareness on human rights. Women should submit to men, though this it sounded like a social norm. Women workload, collecting, and okay, number 6, taking bride price, mean men own man, and sometimes the woman has to bear children to pay for the bride. The 7, perception of lower status of women in the community, which could be a descriptive social norm. Poverty, vulnerability due to morbidity as a result of drought, conflict. It happens, there's no social norms. Forced marriage, they believe that strong men have to force marriage. So it also sounded like a social norm. School dropout, believe that women's brain are weird. We didn't consider it as social norms. But also we found 14th one was women workload, and 15th, controlling reproductive decision or choices for women, like in family planning. It's a social norm that the decision should come from man. Women supporting their men, beating them as a sign of love. Yeah, we have some tribes that even the women partners approve to be beaten, that a man should beat you if he loves you. So considering marriage as, sorry, I can't see this properly, but in general, this is the problem tree, and those are the root causes for GBV that we found. Yes, considering marriage as a social bondage with rich families as a reward. Yeah, also because this is the family is expected to, in return, to get a good package of the bribe, or probably also having control over the family that a woman is coming from. So with sanctions and rewards, we did not have much time to really analyze and include as much as sanction as we needed. But related to these root causes, we found that stigma for those who are there to harmful norms. For example, if you don't beat a woman, you will not be considered that you love her. Any woman challenging it is considered indisciplined and disobedient and can be penalized. And number 3, considering marriage as a social bondage with rich families as a reward. So a number of sanctions and rewards were there, but time was not on our side. So I beg to submit, and if my team members have anything to add, please, I welcome them. Thank you.
Excellent, thank you. Anything else from group 2? All right, well, with that,
Great job, nothing to add.
okay, thank you, Paul. So with that, we'll turn it over to the next group, unpaid care.
Catherine, we had also planned, a direction that we should provide experience from our program. Is this going to happen after having shared with other groups?
Yeah, I'm thinking we can do the share outs from each of the groups, and then we'll come back and apply all of the lessons to all of the groups.
Wonderful, that's okay.
Excellent, thank you so much, John Bosco.
Okay, this was our group, and we had started identifying norm, and then we look at the sanctions. And so we had done about 3 of them, but we'll definitely go over some of them a little more in detail. So the first norm that came from our group, our behavior or our target was women not being paid, for the work they do. It's kind of unpaid labor for their work. So the first one was that they can't expect women who are the ones who bear children to take care of them, including taking care of the sick, and also the in-laws, etc. Yeah. So it is an expectation that the clan has. Yeah. And that is a norm that we identified, and because of the sanctions, that if you don't do it, you will be labeled as a bad woman, and in some cases they may bring another wife, into the home because you have failed to take care of the in-laws, the children, so, and you lose respect. So the man can go and get another woman. So it's an injunctive norm in that perspective. But on the flip side, if you comply with the norm, okay, if you conform to the norm, then you'll stay longer and you'll be liked by your in-laws, you'll be appreciated. So women are forced to continue doing this work because of fear of the sanctions, but also cognizant of the rewards that they can benefit. Yeah. 2, dowry is paid for women and they are expected to do the work. Yeah. This is more of, it has a cultural connotation. So men think that I paid for you, so you have come to do the work. Yeah. So actually in some cultures, they will even ask you, why did I not pay for you? I paid for you. So you've come here, you do the work. Yeah. So that's also kind of an expectation, and it's the men, the men who expect their women to do this work, without being paid. The economic structure of the household, where the cash generating activities are for men. Now, because the men in most of the rural community areas are ones who are engaged in economic activities, cash generating, it is expected that the women will stay at home and do all the work that is at home. Yeah. And if you don't do it again, you'll still be labeled as either a bad woman or a lazy woman. So there are injunctions to it as well. Yeah. I'm bringing the money, so do the other work. It's kind of tit for tat. So it's really a gender norm, yeah, but which is, injunctive in nature. Women are considered to be weaker and expected to stay home and do simpler work. Now that is a gender norm, yeah. In most of the communities, we think that women are weak, so they stay home, do the work at home. Let me go to the town. Let me go and maybe do the hard work. You stay home, do all this. So they also find themselves, kind of staying home, yeah? And the culture, if you look at number 6, they are also nurtured to do that, culturally, that it is their role to stay home. They are weak. They're not supposed to do, that kind of work. And they are also well suited for that work because they are weak. If you look at number 9, so we were going, of course, to a stage of clustering them, but we hadn't gotten to that state. But all those are linked to women being considered weak. Yeah. I think those are it. I think, but one key thing that I wanted to bring out, and maybe for the other groups, is that because the methodology itself, yeah, and it links to the next session, requires that you identify reference groups, yeah, who are influencing that behavior positively or negatively. As you state the norm must have certain characteristics, yeah. It gives pointers to who the reference group is, okay. It gives like it points to who the perpetrator or the victim is, yeah. But also it speaks to the problem. So that is why in the first norm, initially there wasn't the clan expects, yeah, but we include the clan expects so that someone gets to know, okay, this is externally motivated, and so it is social in nature. It's not an individual belief or attitude. Thank you.
Excellent. Thank you so much. You touched on so many really important points there. And I think when we think of culture, we can think about how all of these attitudes, beliefs, as well as the norms, the economy, all of these pieces will shape the behaviors that we're talking about. So I really like how you brought in culture there. So we'll turn it over now to the final one. That was the group that I worked with, group 3. And I think you all can see that now, our problem tree. So I'll let our group members take it from here.
Thank you, Catherine. I think we are privileged to have Catherine amongst us to start the process. And of course, Mark has helped us to jot down, the root causes for the adolescent sexuality. So basically, we did an excellent discussion. Country experiences have been, touched on, and of course, we looked into the various social norms that are actually related to sexuality amongst adolescents, where we have looked into, communication-related issues. I'm sorry, the plane is flying over me, so we looked into communications between parents and adolescents, which is actually the major kind of concern, where the issues of language is always difficult between generations. And of course, talking about sex with children, with adolescents is inappropriate, shameful, and perhaps encourages promiscuity. And we have also looked into the fact that, somebody, a girl who is naive about sex is considered as a good girl. We also have realized in Uganda, that's the Ethiopian case, and I'm sure that's true for the rest of Africa as well. But in Uganda, where there is designated members of the family who teach, the basics, especially before marriage. So these were kind of, points that we delineated, about certain certain important factors. So we started actually talking about which one of those are indeed social norms. So the red ones, as you can see, are mainly the social norms, which are actually socially designated as such. And we started to look into the age inappropriateness, this belief that, is it age appropriate to talk about sex with adolescents? Would it actually encourage promiscuity? And of course, who are considered as good girls in the community, and interventions before marriage about being a good girl, perhaps as a married girl, where the major elements of social norms. Of course, we started also looking into what is it related to, religion, culture. Some of those are actually, intertwined with culture as well as religion. And of course, it's very difficult, to delineate, clear boundary between social norms and religion. Then we started to look into sanctions and the rewards. And yeah, I mean, perhaps, talking about sex with adolescents sometimes could be seen as incestuous, because of the incest taboo, which is the case in Africa. That's perhaps a sanction, talking about it itself is really seen as immoral kind of thing. Secondly, as a reward, being good girl would have a great market. She's marketable. I mean, she could get married early. She could get married without any difficulty. Of course, the family may also get, a bright price, and they will be happy. So we didn't really go into details of these sanctions and rewards, but that's what we have discussed. If I missed anything, my group members, please feel free to add anything missing. Thank you so much.
Excellent. Thank you so much, Mergisa. Is there anyone else from group 3 who would like to share anything? Yeah, I agree. I think Mergisa did a fantastic job at doing this. Sorry, did I miss anyone who wanted to say something? Okay. With that, I'd like to now open it back up. I'm going to stop sharing, and Marilyn, if you could share the slides, thank you. I'd like to open it up to not only our panelists, John Bosco and Ramadan, but also you all to help think more about, you all had a chance to now go through the problem tree activity. And this is one exercise that we would use with the program beneficiaries to help explore the social norms. So I'd like to now think about, the process for this and what might be some areas that would be the most difficult, for example, to implement in a group. Were there any social norms, terms, or concepts that were confusing or difficult that you all might find challenging when you're doing this with the programs? And so we could either open it up to John Bosco and Ramadan to share your own experiences when doing a problem tree with a group, or if you all have insights from, going through this exercise today, we could think through some of these questions. So I'll open it up to the group now for anyone who might like to share any thoughts or insights after this experience on the process of using the problem tree.
Thank you so much, Catherine. This is John Bosco. Just to start, I would like my team members as well to participate and probably share their experience on these questions. I think I had a very brilliant group and they were very active. that's why we came up with a lot of root causes. And I think they can share their experience. So I would like to invite them to share their experience. Probably starting with what was the most illuminating part of this activity. Would feel free to write on the chat box, because I found this approach being more open, and most of the people really like to share through chat box. So feel free to contribute through the chat box. Yes. I think I have a problem with my computer.
Is it only your group, or any other person can comment? Because you said you.
Yeah, let's open it up to anyone. Yeah. And I'd love to hear for anyone who's worked with communities on a problem tree, your experience in implementing this exercise.
Okay. Can I share briefly?
Yes.
Sure,
Okay.
please do.
I think for me, first of all, and from experience, the most, I think, if you may call it illuminating part of the activity, is like how the participatory nature of the activity, yeah, and how it kind of shifts power. Just imagine that the group, we were community beneficiaries, and you know, the implementers had come to the ground to really understand the root causes of the problems that probably their baseline or their assessment had found out. Yeah, so it gives power, it shifts power from the implementer, who normally are the technocrats from you know, the other side, and shifts power to the community, you know, to kind of guide, yeah, the nature of implementation, the nature of issues, but also helping us to understand the problem before we even design. Yeah, so we are able to understand the problem and the root causes of the problem. And in this case, in the examples that we have today, it's when you understand why people behave the way they behave, it's them to kind of tell you why. Yeah, you may just see the behavior of alcoholism and you don't know why they are alcoholic. Yeah, or so if you just design a program without knowing why they are alcoholic and the root cause of why they are alcoholic, the alcoholism may not go. So it helps us to really understand why people behave the way they behave, and it motivates, you know, a bit of community action. Yeah, not necessarily our own. Yeah, we focus on action by the communities down there and who are faced with the actual problem. So I think it was really engaging, and it helps really to focus the problem on the people who are facing it and getting local solutions.
Yeah, excellent. I think that's such a great point. I'm so glad that you raised that. Thanks so much, Ramadan. Yeah, the participatory techniques that are used throughout the social norms exploration tool really help for community buy-in and ownership. So if that's something that your project is at all interested in, these participatory techniques can really help with that process. So for example, by having the community members identify themselves what the root causes are, there's more ownership in having them then address and challenge those root causes. Excellent. Thank you so much. We have about 2 more minutes for any final comments from anyone who.
I have a comment in terms of the exercise was very useful. But I just noticed that the causes eventually turns out to be the norms. Is that correct? The causes, because we had a norm that women are usually not paid for the care work, and that is expected. You know, that's what people think, and that's what others expect. Then when we move to the cause, to the problem tree, quite a number of the things that are mentioned as causes of that turn into norms.
Mhm. Yeah. Yeah, I agree. As a norms researcher, I think that everything is norms related. I know that's not true, but it seems like if we can shift social norms, that there are many behaviors and problems that we face that would be ameliorated. So, you know, I think, you know, with adolescent contraceptive use, of course, the contraceptives have to be in place. The health clinics have to be there. You have to have trained providers. But many of the other issues, once those structural issues are put into place, do seem to be more normative.
Yeah, they're different. They're not. I think the question we have to have is to have all behaviors that are actually not social norms, but they can easily be shifted to be social norms or gender norms. Yeah, that's what I wanted, I think, to comment on. Make sure that is, the clarity around that not all behaviors are social norms.
Yeah, thank you. Yeah, let's move on to the next slides. I see a few more hands, but we'll have some time at the end for the final questions and answers as we wrap up. But we'll move now into our discussion about how to identify reference groups. I think it was Ramadan who was talking about the importance of that methodology as well. So Marilyn, we'll go into the next slide on identifying reference groups. So reference groups are, we can move to the next slide, please, Marilyn. Oh, Marilyn? Maybe she might have a problem with sharing her screen here. So, okay, I'll just share mine here. Oh, Marilyn?
Sorry about that. I'm going
Oh,
to
no, you're
try
fine.
to share it again.
Oh, great, thank you. Okay, so on the next slide, so we see that, again, reference groups are the people whose opinions matter to me for a particular behavior or context. So Ramadan was talking about the importance when we're thinking about the sanctions, the rewards or punishment, that we're also thinking about the people who would be enforcing those rewards or sanctions. So an example here, you can click to the next little bit, Marilyn. An example here would be that my brother and aunties all got married before they finished school and tell me I should get married as well. But my friends would be disappointed in me if I left school to get married. So we see the different reference groups and how they would have different rewards or sanctions, depending on who those reference groups are. So in phase 2, activity 1, you would adapt the social networks exercise. And this is all on, you'll see in the PDF on SNET page 26. And the purpose of adapting that exercise is to create a series of interview questions that would be designed to learn about which people comprise the main population's reference groups. So for example, in the previous one where we're talking about my aunties all left school, but my classmates would be disappointed in me. So that our main population of interest would probably be university students. And we're trying to identify the people who would provide guidance, information, or support on a specific issue related to the behavior of interest. So on the next slide, we see that these questions that we would be asking would help us to understand who the people trust to talk about an issue. Like, should I be getting married now? Who do I turn to and ask that question? Who you would seek assistance from? These are all very related questions, but essentially, like, who would support you? And so these are what we call speed interviews. So we're going to do a quick Menti poll, and I'd like you all to think about the following question on the next slide. So if you or a friend experienced gender-based violence, or someone in your community did, who would you turn to for help or support? So you can follow this link. We'll put it in the chat box for everyone. So you just click on the link in the chat and go to Menti. You can just type in up to 3 words or people who you would turn to for advice or support with this issue. So we'll just take 1 minute for this. Okay, great. So we see a few of them coming in, ranging from more institutional level individuals, such as police members, or police officers or lawyers, to friends, family, specifically an aunt, and also perhaps media, which is really important for shifting norms too. Oh, wow, we have a lot. Okay, so the police gender desk. Yeah, so there are a number of institutional sources for advice, social workers, police, lawyers, counselors, to more close friends. And some people, it may be normative where you, in fact, wouldn't turn to anyone for help with gender-based violence. Many people who are survivors of gender-based violence decide not to turn to anyone because it is normative to feel ashamed that that violence happened to you. So that would be another important consideration when working with individuals who are survivors of gender-based violence. So let's just wrap this up quickly. Marilyn, we can go back to the tool, the slides. Thank you all for your ideas here. And on the slide, you'll see that on table 6, this shows you just an example of how the social norms tool, social norms exploration tool, is designed to really elicit these reference groups. So again, it would be about 5 to 10 minutes per interview, and you would just be working one-on-one with people in your population to ask them about these questions. So you might want to ask, exactly the question that we asked in the Menti poll, and then tailor those to your behavior of interest. And so then at the end of the interview, you would have a list of all of the individuals, and you would analyze the data then to see who emerges as, a key reference group in your population. So for example, maybe close friends came up more often than not in all of the interviews that you did with your population. And then the importance of doing this is to not only know who would be this important person in the lives of your population, but also to potentially tailor your program to begin working with those important individuals as well. So some of the work that we've done identified grandmothers as the key gatekeepers to some of the behaviors. And the programs actually started working with the grandmothers themselves to help shape the support that the grandmothers were able to provide. So I know we've gone over this all very quickly. It seems as though after each of these sessions that there's still so much more to talk about. But we have about 10 minutes here at the end to get back into our questions and answers and to answer any questions or concerns or ideas that you all might want to share before we end here in about 10 minutes. So I'll turn it over to all of you now to hear more about your thoughts and questions. Yeah, please go ahead, Ramadan.
Mine is not a question, but in relation to what Grace said, it's very, I think, important to have those boundaries. How would you differentiate between a norm and what is not a norm? Yeah. So in the we adapted one of on one of the behaviors. I think it was violence against children. It was child violent disciplining, yeah, for children. And when we came to the social norms exploration, we used the tool and the approach to identify not just social norms, but also separate what are beliefs, attitudes, practices, yeah, so that we don't mix the structural, the economic, the attitudinal issues with norms. So again, the social norm exploration tool really helps you to be able to draw a line, yeah, between beliefs, attitudes, and social norms, so that you don't fall in the trap of calling everything a social norm. Yeah, so it gets back to the preparation stage, as people are being maybe trained or oriented. That also should be given a focus. How do you differentiate attitude, belief, norm for your programming? And then the program, of course, will have interventions that respond to attitudes, to beliefs, perceptions, and norms. Thank you.
Yeah, excellent point. Thank you so much, Ramadan. I think there's a lot of the challenge in working with communities initially is exactly what you were talking about, is carefully distinguishing the difference between an attitude, a belief, and a norm. And I think a lot of the programs, at least traditionally, have focused on knowledge generation. So for example, knowledge that violence is bad, right? And so that knowledge can shape an individual's beliefs or attitudes, but without this change in the larger social normative world where it's seen as acceptable to beat your wife, there won't be a lot of change in the behavior because it's still seen as acceptable to do that. So there are many instances when individuals' attitudes or beliefs may differ from the larger social norm at play. So I think that's an excellent point, and something that you all, as you implement this work in the communities that you are implementing in, make those careful distinctions, as Ramadan has wonderfully suggested. I see a question in the chat. It says, are the stories generated from the community? Yeah, so I think, Esther, maybe you're talking about the vignettes or the questions. And yes, absolutely. An important part of this is tailoring the materials, the reference groups, the populations of interest to the communities that you're working in. And that really helps with additional community buy-in. Is there anyone who's worked with the social norms exploration tool who would like to talk about how they tailored their work to the community?
The social norms very true, but I wouldn't claim that I'm an expert because I had the tool here in the last training. It was my first time to hear about it. But I got impressed because I just at that point I was planning to start a field work on social norms and how they impact one and how they influence women's work and economic empowerment. And so I simply took that tool and I tried to use it to derive the relevant questions, to get the reference groups, and to simply go out there. I used a lot of the vignettes. I used a lot of the whys, and yeah, so far so good. We are getting very interesting insights, even though we are just trying to understand how these norms impact the ability of women to work and how they also impact the economic empowerment.
Excellent. And Joy, could you tell us a little bit about how you developed the vignettes?
Oh, the vignettes. It's difficult to make them beforehand because you wanted to hear, because if you make them from what you imagine, you may think that it's not the right thing on the ground. But then once you go there and you hear some of the issues, you can, some of the issues which are not very clear, you can come up with something like Joyce recently found work that requires to wake up, to report early, and she has to leave a little bit earlier to beat the traffic, and she has to work late, and she has to come back a little bit late because of traffic and because sometimes she may be required to do overtime due to the nature of our work. And then the question is, would that be acceptable, or would that be problematic should that be problematic to the husband? And then that brings out a discussion. Then you ask why, and then issues of who will do our duties in the home. In other words, even if the woman works as hard as how, she still has to come and do housework. So all those things come in when you do that. As in, you try to tailor a story relevant to what you're talking about and see how people react to an imaginary character, but bringing in an issue that you want people to imagine that is happening.
Excellent. So you heard from the community through interviews and then created the vignettes based on what you were hearing in the interviews. Is that right?
The ones I made before I went to the field, some of them were based on a lot of my expectations, but I was able to rectify them in the field. Like, for example, I was imagining that Alice, something like before I went to the field, as one was like Alice has brought up a daughter and a son in a way that they can all do housework at home. And Alice believes that by so doing, she'll change the norm that housework belongs to women, rather anybody can do housework. When I go to the field, of course, that was discussed, but I realized that it's not necessarily the case what I thought. Of course, it was a vignette which really helped me open my eyes. But the point is that it does not necessarily work because it turns out that Alice's children will do that when they're in their home. And as long as many men continue staying away from housework, and these kids become independent, and independence about being able to make their own decisions, having a girlfriend, even the girlfriends will do their domestic chores for them, leave alone a wife. So yeah. I made that film, but then going to the field, I realized that really what I was thinking was not right, but I learned something.
Mm-hmm. Excellent. Thank you, Joy. I feel like we could have another whole session on the development of vignettes. But thank you for that, sharing your experiences there. John Bosco, would you like to share something before we go?
Yes, Catherine. I wanted also to share my experience from Tanzania FHI through the USAID Tronge Afya project. Interesting with the host norm exploration is that has contributed in different way in terms of changing our communication particularly, and interesting is the people that we found that are most reliable and associated with the number of youth, especially in family planning, such as service providers. We also come to find out that they are one of the people who could cause sanctions for young people to receive family planning services at the workplace, because providers as well are part of the community, and they were born in the community, and they have deep kind of deep-rooted social norms. So this ended up as also coming up with the provider behavior change module that targets biasness into providing family planning services to young people. It also led us to also to developing the module for male engagement, because of the issues that were related to gender imbalance and decision making, and actually the negative attitude of men towards family planning, and how also they are the decision makers into the families. We also ended up coming out with a program and a tool to engage male into their hangout corners, as we engaged them to come up with the best way that we can engage their colleagues. So there was a co-designing, and we are doing co-delivery currently. But also my colleague Mark is here. He has a lot of experience into the, especially how he went through the 5 stages, but I don't want him to go into details and see tell experience on the report of the social norm he did. Mark, if you're around, please, can you chip in?
Yeah, thank you, John Bosco. Just to summarize, the SNET experience was very informative and participatory. Throughout the 5 stages, it was important that we engaged our government partners, because when it comes to project implementation, we always rely on basically what their needs are. So with regards to government partners, they were actually interested in actually addressing social norms as part of the implementation plan for the ministry. So it was an opportunity for us to actually use the SNET, and the good thing is we involved them from the first stage, which was planning and preparations for using the tool and the activities, and we identified our behaviors of interest from the beginning. So it was a participatory, but also a team building exercise, which was very, very engaging from the beginning. And towards the end, even towards data collection, the field activities, they were also with us. So it was very, very engaging, and they liked it. They actually learned a lot, and they embraced the whole experience with regards to norms. I won't go into detail because JB has covered a lot of things that we used as regards to social norms, and we realized that as a project, we had not covered a lot of issues with regards to our development strategy, with regards to the implementation of the project. Certain audiences were left out from the beginning. For example, elders and female influencers within social settings. For example, the mothers-in-law, the aunties, the grandmothers. These are groups that we are not involved or we are not considered within our interventions, and also, as well as parents for the youths and married youths particularly. So the SNET actually supplemented what we had not yet considered or addressed at the beginning. And like JB, John Bosco mentioned, for the interventions that we used, we also developed an intervention particularly for women, where we could integrate the elder influencers, the female influencers, new mothers, experienced mothers, so that we could actually bridge the gap between these generations, where to actually make them understand the significance of actually appreciating new technology, new science with regards to family planning and reproductive health, as well as the ever-changing context of the social environment that we live in. So just in a nutshell, this is something that we actually embraced, and we are still using the findings to improve our interventions and develop new interventions for other new projects to continue from where we live as far as the project is concerned. Thank you.
That's so cool. Thank you so much for sharing your experiences with the SNET, Mark and John Bosco. That's excellent. With that, Professor Grace, I will turn it over to you for any final comments that you'd like to make before we close for the day.
Yeah. This has really been super good, and I want to thank all of you. Thank the and the other moderators and the sharing of experiences. I think now we are much further than where we left last time, and the learning continues. And on behalf of the East African Learning Collaborative, we want to really appreciate your time and effort to give us this training and capacity building. And those of us who have attended, thank you very much. And we hope you'll also share with your colleagues. This has really been more practical, and now we know how to move forward. And some of us already, the team of us, myself, Madanda, and Paul, and Florence, we are on an unpaid care work project by IDRC. We use some of the vignettes and some of those tools, and it was very interesting that at times they also check what people say and how they respond when they hear the story. And I think one of the things maybe we need to note that when those stories are made, we should be also observant on people's expressions on the face. I remember like some of the men's group, they went silent. They just couldn't believe that the men the story we were giving could happen anywhere. So, but you could see the expression on their heads, really out of shock that can happen anywhere. So thank you very much. And we definitely look forward to other engagements and other capacity building sessions. So I want to wish you a good evening, and thank you very much.
Thank you so much for Professor Grace, and thank you everyone for being here. A special thanks to...
I don't know if people want to unmute so that someone can take a picture of all those who have been attending. I don't know.